see all the details on what happened to me, 70 plus hours video documentation at YouTube channel My Medical Nightmare. Alright, before we get started, my email contact is shown on screen. It's futurecloneguy@gmail.com. If you represent a hospital, a doctor, or a medical practice that I had dealings with that are named in these videos, and your issues with me are outstanding, unresolved, you need to contact me immediately and get this fixed. Following the numerous interactions with less than reputable professionals, be advised, I will not speak to you or your representative until money changes hands first. Yet another doctor in my case is potentially looking at the end of his professional career, civil and criminal penalties, possible prison time, fines, after being caught on video, berating and cussing out a nurse in the process of performing surgery. 1,500 comments, 173,000 views thus far. Dr. Deukmedjian, MD, of the Neuro-Spine Institute, located in the state of Florida. I'll go into the details of my own situation later on and play my recorded phone call from my 2022 free MRI review consultation with him. Summarizing briefly, I contacted Dr. Deukmedjian regarding a very serious head trauma and broken skull injury. I sent him CT images and MRIs. You can hear in our consult, he would not acknowledge my injury, which included 6 inches diameter observable infection in my head and neck area. He then claimed that his expertise did not lie in this area. I believe that Dr. Deukmedjian did possess the skills to acknowledge the truth of what happened to me, and he chose not to. I believe Dr. Deukmedjian attempted to bluff me on the reality of the extent of my injuries and may have been covering for the errors of the previous radiological doctors who misdiagnosed me, stated in their own write-ups from my imagery that no injuries existed. A video recording is being circulated on the internet. This is courtesy the Space Coast rocket. The video was posted to their Facebook profile. Disturbing behavior by a surgeon on Facebook Live. In the video you can see and hear what is alleged to be Dr. Deukmedjian performing a surgical procedure. I cannot and will not repost this video, but the audio is not suitable for family audiences. He launches into a tirade against a nurse who's assisting him in this operation. 1,500 comments, 173,000 views thus far. The doctor calls out the nurse. The nurse responds and offends the doctor, and then he launches into a litany of cursing, dropping F-bombs. Deukmedjian tells her he doesn't give a F how long she's been a nurse. He berates the nurse over the course of several seconds, and then apparently attempts to relieve her of her duties. According to some reports, she was fired on the spot. He verbally attacks the other members of the operating team, saying, "You guys are effing unbelievable." Totally unacceptable behavior by this doctor. I tried to warn people about this guy. What happened in my case is actually far worse than what you can hear in this video. I filed a complaint with the Florida Department of Health. My own case was dismissed. My experience dealing with the Florida Department of Health indicates to me that they are lazy. Florida seems to have the disposition of being a host of many negligent doctors, some criminally, and they don't possess the enforcement capacity to regulate the medical industry there. A very sad situation. And then you also hear that he reads the reports that were given to me. And yeah, if you go to see my other videos, I was misdiagnosed in many of these visits. And I pointed this out to him. Again, a good doctor who does an MRI review. Is he looking at the MRIs, the actual images, or is he looking at what the doctor wrote out? Because doctors who are just repeating the words of other doctors, that's not what practicing medicine is about. All right. Real doctors out there, they apply their skill that they went to college for all these years to obtain these degrees, to present to the Department of Health of Florida and obtain these medical licenses that they then go on to use as their profession and make millions of dollars every single year. Okay, so this doctor, he did not do his job properly. Injuries are present in these pictures. You'll hear he tries to argue with me, a patient who knows otherwise.
I'm Dr. Deukmedjian.
Hello.
I looked at your MRI, and I know it's a bit old, but I had a chance to take a peek at it. What's going on? Are you having neck pain?
Yeah, and a lot worse than that. Okay, my hand, it's on my left side, upper area of my neck, lower skull.
What's bothering you? What's hurting you?
Okay, I have for the last 4 years intense pain on the left side of my neck. I cannot turn my head left or right easily.
Take your collar off and put your finger exactly where it's hurting you so I can see it.
Okay. Yeah, give me a minute because there's a lot of pain here. Okay. Yeah, I can't really turn my head so easily.
Yeah, go ahead and show me exactly where it's hurting you with one finger.
Okay.
I need you to turn more. I gotta.
Okay.
Don't look at me. I need to. There we go. That's what I need to see.
Right here.
Left side.
Left side, yes, sir.
And just turning to the side hurts like heck.
Moving my head out of a very limited range of articulation is a lot of pain.
What about turning to the right side? No problem?
I cannot turn left, right, up, or down very easily. There's a lot of pain.
So much.
Yeah.
I think I know what's wrong.
Did you take a look at those images?
Oh yeah, I'm looking at them right now. Sorry, I'll share my screen with you. I apologize.
Yeah, I got the images here too that I can share possibly.
I don't need you to share with me.
Okay.
I have them right here. This is your MRI right here.
Okay.
All right. So the good news is you don't have any herniated disc on this MRI that I can see. Now your pain is coming up from C1, C2.
Yeah, it's around. I think it's around. Okay, could you go back? Yeah, you go. Anyway, you just passed that area where I believe there's a serious issue right here.
Okay.
Well, can you go? I wish that I could.
Here.
Okay, right there, and then it's below my brain. Can you see that?
Right here.
Yeah, that area to the left of your mouse cursor. Okay, now you moved out of the range. Okay, yeah, right there, and then to the left and up of your mouse cursor. That area right there, and you can see that the injury, it also kind of covers.
What injury are you talking about?
Okay, I'm talking about this broken piece of bone that came off the underside of my skull.
No, I don't think you have a broken piece of bone going on.
Is it possible for me to share these images, because I can show you otherwise? In 2018, I believe I broke the underside of my skull, and you can see this in these pictures.
But listen, you wouldn't see that on an MRI.
Yeah, you can. You can see also the side effects, because I broke the underside of my skull and I went into this emergency department. I was misdiagnosed, and then after several months passed, the area became infected. Do you have that other MRI? The MRI?
Listen, it doesn't matter because I don't treat this kind of stuff.
Okay, well, it's in the area of my spine, sir. You're a doctor, right?
I'm a doctor.
Okay. I wish that I got the pictures printed out here.
It doesn't matter. There's nothing I can do to help you in this area.
Okay, but yeah, it's going to be in the area
Yeah, again, I'm not an expert, and I don't deal with this area, so I'm not going to address it with you.
First, second vertebrae. You deal with that issue, don't you? You can see an injury in that area. Can you bring up the overhead imagery, please? Of the go to the brain or the yeah. Okay, this one. Yeah, and I gotta get to
the top right there.
Okay. Can you bring? There's some other pictures in here.
That's what I have.
Okay. You got to bring up the.
But if this is below your brain, I'm not dealing with that. I already told you that.
Okay. Well, yeah, it's actually in the area. I think I broke the underside of my skull. There may be damage in that area.
Deal with that part. You're going to have to go see a neurosurgeon that does.
But okay, you can look at these pictures. Can you tell me if there's an injury or not?
I cannot. No.
You cannot.
I'm not. I don't deal with that area.
Okay. Well,
what
you can.
What does the report say?
What does the report say? Well, you're the doctor. I wanted to ask you, sir.
Yeah, this is an MRI consultation for the spine.
Okay. Can you go to that area?
Do brain stuff.
First, second vertebrae in the cervical column of my neck, and I've got an injury there that you can see.
It doesn't say anything here about first and second.
Okay, can you bring up...
The MRI of the cervical spine is essentially unremarkable.
Okay, you're going to have to look at the pictures. I was misdiagnosed.
Yeah, I'm not going to help you with that. That's not what I do. I
here,
deal with spine issues.
if you go up to this area where you were on the profile, you can...
We're done.
We're done. We're not done. Well, I'm not done because I got a real serious injury I need to have looked at. Right here. There's my brain. There's the cervical column. T1, T2. I got a broken piece of bone under my skull.